Leishmaniasis is transmitted by female sandflies which belong to the phlebotomys, Lutzomyia, and Psychodopicus genera. In addition to causing human disease, Leishmaniasis has many mammalian reservoirs that it can also infect. The most notable of these include canines, rodents, sloths, and marsupials. The life cycle of Leishmaniasis consists of two stages: promastigotes in sandfly vectors, and amastigotes in humans and other mammalian reservoirs. Promastigotes are extracellular parasites that are motile and have flagella. They multiply within the midgut of the sandfly before migrating to the proboscis, where they are injected into the human host during a blood meal. Once inside, promastigotes are phagocytized by macrophages, where they then transform into amastigotes. Amastigotes are intracellular parasites that are immobile and do not have flagella. They invade and multiply within the cells of various tissues and macrophages. Uninfected sandflies become vectors when they ingest amastigotes in macrophages during a blood meal of a diseased host. Amastigotes then retransform into promastigotes and then begin multiplying in the midgut of the sandfly. Promastigotes are seen in the image on the bottom right and are characterized by their flagellated, spindle-shaped bodies. Amastigotes are seen on the image on the upper left as inert, oval-shaped intracellular organisms.
There are two types of Kala-Azar, or visceral leishmaniasis. One occurs in both dogs and humans, and is caused by the parasite Leishmania infantum. It occurs in southern Europe, the Middle East, and Brazil. The second type, caused by the parasite Leishmania donovani, affects Asia and Africa. Both parasites are transmitted in the same way. They use an intermediary, a vector, a tiny blood-sucking fly, barely a few millimeters long, the female phlebotomys, or sandfly. When the fly bites an already infected person, the phlebotomys ingests the parasites along with its victim's blood. If the phlebotomys then bites someone else, it transmits these parasites to the new victim. Inside the human body, the macrophages, immune cells whose job it is to destroy pathogens, swallow up the parasites. If the immune system succeeds in fighting the infection, the victim is immunized against any future attacks. But if the immune system loses the battle, the victim falls seriously ill very rapidly. Inside the macrophages, the parasite changes form, multiplies, and invades all the organs with a distinct preference for the spleen and the liver. The first signs of the disease are fever, anemia, and an enlarged spleen and liver. If left untreated, the patient dies. In Asia, the disease is nicknamed black fever because the skin often darkens. Leishmaniasis weakens the immune system, leaving patients vulnerable to so-called opportunistic diseases, like tuberculosis, malaria, or dysentery. Leishmaniasis is itself an opportunistic disease. People living with HIV are more susceptible to the parasite growing rapidly in their bodies. And when a phlebotomist bites someone who is co-infected, it ingests a higher parasite load, which it will transmit when it bites again. This makes co-infected patients an important reservoir for the transmission of Kala-Azar. Visceral leishmaniasis occurs in Africa, Asia, and Brazil. In Africa, there is a rapid diagnostic test for the disease. To confirm the diagnosis, a blood test, or a spleen or bone marrow biopsy is required. These tests can only be carried out in well-equipped laboratories, which aren't available in rural areas.
I found out my child was sick because he was vomiting and had a fever every night. We took him to the hospital in Adong. It was after he was sent to Malakal that we found out he had Kala-Azar.
Since 2010, doctors have been prescribing a 17-day treatment using two drugs, meglumine antimoniate and paromomycin. By cutting the duration of treatment in half, the burden is reduced for patients, the staff, and the facilities. Severely ill patients, the elderly and pregnant women, receive a different treatment because meglumine antimoniate has poor results and increases the risk of death in these patients. It is very difficult to treat patients co-infected with HIV and visceral leishmaniasis. They are never fully cured of visceral leishmaniasis and will always be at risk of recurrence. In Asia, leishmaniasis is more easily diagnosed and treated. The World Health Organization recommends ambisome that is administered as one single infusion over 2 hours. The recovery rate is more than 98%. It's already being used in national programs in India and Bangladesh. Unfortunately, ambisome is not heat tolerant and is only administered intravenously.